Amazing hair transplant results. Today, let us talk about Mr. Shashank Jain, who came to us with a lot of queries, and he was very much annoyed by the amount of hair loss he has had, by the amount of thinning on his scalp, and he felt nothing is working for him. Believe me, he tried every possible thing under the sun, all the home remedies. He himself told us a number of oils, anything anyone told him, he applied on the scalp. But then the hair loss kept on going, and the thinning was so much that he kept his hair quite long so that he could comb the rest of the hair and nobody could see the visible scalp. He was disturbed by it, so much so that his functioning was disturbed also along with his family. He decided to consult us as hair doctors and he came to us. So after doing trichoscopy, we did a long-term planning and treatment for him. And how we did it, what was the result, was he happy or not, let us discuss. But first, I would request you to please subscribe this channel so that you get more and more such educational and testimonial videos. My name is Dr. Preeti Saraswat and today we'll be discussing Mr. Shashank Jain's result after 6 months only. So we did his trichoscopy first. Tricho means hair, scopy means when we try to see something under magnification. So there is this software and a very good machine which has a camera along with magnification, and we find out everything with the computer screen. So with trichoscopy we found that his diameter of individual shafts at the donor area was on an average 0.07 millimeters. This comes usually in the terminal hair age group. It means the hair is good to be harvested and transplanted. The ratio normally is 9:1, so his was normal. Again, when we find out the area of donor site, we found that it was around 5 cm in width and around 30 cm transversely, so it made 150 cm square. And when we multiplied it with the density we found on trichoscopy, which was 80, so it gave us around 12,000 grafts, from which we could pick and choose the best of them to be transplanted on the recipient side. So you see, when we saw on the recipient side, we could make out that the hair which are there, which are still existing, are either intermediate but maximum were less than 0.03 millimeters, which are vellus. Vellus hairs are bound to go. They will go whether you take medicine or you don't, whether you take PRP or you don't. So we calculated the recipient area. When we measured it, it was around 94.4 centimeters square. We were thinking of giving a density of 35 grafts per centimeter square. He had some existing grafts which we had to respect and they were to be kept in place, and therefore 35 grafts per centimeter square when put in the existing hair, we thought the look will be quite decent. The rest of the measurements, how many 1 head, 2 head, 3 head, 4 head grafts were there for him, you can see on the screen. So if you're liking such detailed analysis of Mr. Jain, then please hit the like button, and then now we'll go to actual procedure. Mr. Shashank was given all the pre-operative do's and don'ts. We also asked him to take a heavy breakfast before he came on the day of procedure. Because the anesthesia we give is a local anesthesia in a ring fashion, so the patient is always talking and we are having a good conversation while we are doing the procedure. No GA or other anesthesia is required, only local. After having a nice breakfast, he came to us. Then we did sensitivity test for him, sensitivity for all the local anesthetic drugs as well as the antibiotics we were to give, so that there is no risk of giving those drugs to him and he is comfortable. After that, we drew the proper hairline for him, and after he consented with the hairline, again we shaved his scalp as was pre-decided. We had talked about it, and after that we took him inside the theatre for doing the procedure. In doing the procedure, first we did the slit making. It is always done to be very sure regarding the angle, direction and density of the slits we make, so that the grafts which come out, the hair which come out, have a proper natural angulation and direction. So the slits were made properly, and then Mr. Shashank was told to lie on the stomach, which is prone position, and we took out the grafts. So both in slit making and in graft harvesting, the machines which we have, they calculate the numbers which we do for slit making and harvesting both, so that they are equal to each other, leaving a few grafts which we always take out more, 1 or 2%, so that we always have ample of grafts. Then keeping in view that they need to be properly hydrated and everything, we gave a lunch break to him, then he came back and we started putting the grafts. This whole procedure was seamless, and as he told afterwards that he slept for some time also, he was very comfortable. Later in the evening when we were done, he was ready to go. He was in high spirits, he was well rested. We told him what all medicines to take. He was given a bag and how he has to wet his hairs, and we called him for a shampoo after 3 days, during which we took out the bandage at the back. Later he came for 2 or 3 PRPs, and then when he came now after 6 months, he was so happy with the growth he had, with the hair he had. He was so full of confidence that he himself said, "Madam, I want to tell people, I want to tell the whole world my hair transformation journey. I want people to know that this is one procedure you can get done at a proper, reputed, certified center with ABHRS, ISHRS doctors, so that you know whom you are going to and you are confident that you will be given the best possible service." Even after the surgery, he was in constant touch with us and our staff, and he was so happy that he was given every possible help from our side, and now he is very happy, as you can see in his testimonial now. So over to Mr. Shashank.
Hello everyone. So my name is Shashank Jain. So my age is 27 currently. So I'm actually belonging from the Bodla. So in my profession, from my profession, I'm the software engineer. And I was facing the hair fall from maybe the past 2-3 years back. So I have a lack of the confidence when I'm going outside, wearing the caps as well. So first of all, I was making the treatment from the home, I can prevent my hair fall. It was not resolving my hair fall. So what I did, I just did again the research and to find the best doctor from the nearby location, which is the Agra. Agra is nearby from Bodla. So what I did a lot of research to find the doctor. And when I found the doctor, I found the Saraswat hospital. He's a very good doctor. So based on the ranking, whatever the blogs and other website, when I visit, he is a good doctor in the ranking. So what I did, I visited to the clinic. So they suggest me so you're the treatment. So they suggest me the hair transplant. So they helped me to make me understand. So the treatment, the hair transplant will not be a painful. So okay, I agreed with that. So I go ahead for the hair transplant treatment. The treatment is good. So after the 6 months, so you can see my hair transplant the result is very good. It was painless. You can go ahead and come to here. They are the very helpful team as well as doctor. You can directly connect with them. So whatever you want to ask, you can go ahead and and if you have the hair fall, you can come here. They are very good team members. They will suggest all the medicines, whatever the best for you, including the diet. So you can come and visit. Thank you.
If there is someone in your family or amongst your friends whom you think this video will help in making out a decision where and how to undergo this hair transplant, you can share this video with them. And also, if you have a query as to how come the cost of hair transplant is so different in different centers, you can view the video on the end screen. Thank you.